So my name is Amanda Bennett. I'm a clinical educator with Suffolk Community Healthcare. The PEBLS model has been applied to community hospitals and to the community nursing teams. In the community hospitals, the model has followed very much alongside the acute model. So we have learning bays and the students are responsible for the care of allocated patients, and they have their learning hours usually in the afternoon to look at the evidence base behind the care they've delivered that morning. In the community, the coach is usually the person that the student is going out with that day. So it's usually a registered nurse, but sometimes it can be a third-year student, could be the coach for a first-year student. On a day-to-day basis, within the community nursing teams, the PEBLS model is rolled out. It starts that the students will identify which patients they're going to be working with that day, and they will go out with their coach to visit their patients. As much as possible and within their competencies, the students will deliver the care to those patients. And then following this, the student would have identified an area of learning that they want to concentrate on for that day. They'll have a discussion with their coach, and their coach will help them identify a learning goal based on the care delivered that morning. The student then takes that learning goal and they have an hour off in the afternoon, protected time, that they can research that learning goal, where they look at the evidence base behind the care that they delivered. Following that, in the afternoon later on, the student will feed back to the coach the learning that they've gained. Sometimes we try and do this so the students feed back in a group together so they can benefit from peer learning. So far, we've found that the students are a lot more confident. They can really link the theory to practice because they're learning in a timely manner. They're learning that day the evidence base and the research behind the care that they've delivered. The coaching approach really helps the mentor. It helps because other members of the team can be a coach, and so the student will go out with other members of the team. And every day the coach will write in the student's learning log how the student has met their learning objectives. This then forms a big log of all the students' learning objectives and the feedback from the coaches, which provides evidence to the mentor of the student's learning. A good coach helps the students identify their own learning goals and actions by asking them open questions. A good coach will empower the student and support the student in their learning rather than telling them and instructing them what to do all the time. The main benefits to PEBLS are that it allows the student to link the theory to their practice on a daily basis. It also increases their confidence and it makes them more autonomous in their learning. The challenges are that sometimes in the community, because of the way the community works, it's not always easy to find a time to link in the afternoon with their coaches again for the feedback sessions. But we have overcome this in some teams by having the feedback sessions in the next morning. The role of the clinical educator is to train the teams in the coaching methodology. This will then go on and benefit the students as they're being coached in their practice. Also, within the community, we offer training sessions to the students to help them with their clinical skills and with coaching sessions as well.
Hello, my name is Queen Bee Rose Lasaria. I'm in Year 3 at the University of Suffolk.
Hello, my name is Jade Henson. I'm a third-year student nurse at the University of Suffolk.
I've really enjoyed my PEBLS experience in the community because it allows me to explore my capabilities as a student nurse to be able to deliver that effective and safe practice to my service users and their families. And also I've enjoyed it because I was given that opportunity to build rapport and trust from my from my patients and their families, as well as the members of the multidisciplinary team that I'm working with.
I really enjoyed my PEBLS experience within the community because it enabled me to work collaboratively with other healthcare professionals and being able to work primarily with my patients. If I had a mentor, which what normally happens is you kind of follow them about and you kind of do what they say, but as PEBLS I found that I was actually able to lead patient-centred care firsthand, and the coach was challenging me on things that I was doing, and it really got me to question my own learning and my own practice towards my patients.
With PEBLS, I am allowed to work independently, and of course with the supervision of my coach within the day and my mentor. So I'm given a chance to explore and lead the care independently, and to be able to think critically with regards to the patients that I'm looking after. PEBLS changed the way I learn and practice because it enhanced my confidence to lead the care that I'm going to deliver to my patients. With PEBLS, I learned to become more independent if I compare it to my previous experiences in practice. Like now, because I have my own patients to look after, then it enhances my understanding and knowledge on how to deal with this particular service user independently. And it also challenges me, because I believe that PEBLS is a high challenge as a student nurse. But then because I am given the opportunity to lead the care, then it builds up my confidence.
PEBLS has definitely changed the way I learn and practice because I'm able to go away and actually look at what I've done within practice. So within the community, if I'm given an injection or I'm doing a leg dressing, it's not just I did that leg dressing, I did that injection. I actually go away and I'm starting to look at these things. So why did I give that injection? What is it used for? What stuff am I using on leg dressings and what are they used for? And I just think that it makes you think more and you learn more, and you then go back and you ask the team members, the different nursing staff, what do you think of this? And I just think it's a really good way of learning. You're really thinking about things.
With the learning log, I have a PEBLS diary, which I used every day. I have 1 hour protected time that I can use to go out and search the literature that which is based on the topic that I have chosen during the day. So for example, if I go out in the community and I have an interesting topic that I really want to go and learn about, let's say for example diabetes, type 1 diabetes, just for example, then I have that an hour to go out and see what are the available evidences in the literature. And also it encouraged me to work collaboratively with other members of the team, because that's when I communicate with them and ask questions, and they would answer it based on the knowledge they have.
The way I used my learning log was each day I would go out into the community and I would pick a patient, and they may have like a complex need that I really wanted to learn about that specific day. So I'd discuss it with my mentor, well my coach in this case, and I'd go back and I would look up that specific topic. So it might be diabetes, or it might be ketoacidosis, and I didn't quite have an understanding of it. So I'd go back and I'd write down the learning objective for the day, and I'd speak to my coach about it, and if they're okay with it, I'd then go away and look it up, do a bit of research on it, and if I needed to, I could ask other team members. And then at the end of the day, once I've learnt about it, I'd then go back to my coach and we'd kind of go through it, and they'd then question me on things that I'd learned and to see whether I actually had a good understanding of it. And I really think that was a really good way, because the next time I went and say my patient had ketoacidosis or diabetes, I had more of an understanding. It wasn't just, oh, they've got that. I really knew the anatomy of it and the pathophysiology, and it was really, really good. The way I used my enhanced handover was I was working with a fellow student of mine, and we did a presentation towards all the nursing staff and fellow students within the community, and we did it on diabetes and when to test for people's ketones in their urine if they've got a high blood sugar. and it really benefited the whole team, especially the students that were watching, because I think, like me, I wasn't very aware of what the parameters was when I did the presentation, and I think for the fellow students that really helped, and it helped to just reinforce it as a team so everyone was aware. As a senior student, being able to work with the more junior students was really good. It was nice for them to actually come to me and ask me questions, because knowing that I'm going to qualify very soon is a scary thought, and I kind of feel sometimes not ready, like I don't have the answers for everything, which I'm not going to, because we're still learning, we're still progressing, even when we are qualified. And I was actually able to be like, I do know this, I'm able to speak to them like, actually I do know this, I know more than what I think. But if I wasn't able to address an issue, then I would direct them to the correct person. But in that way, it was really good because it helped my learning and my confidence at the same time.
The benefits of using PEBLS, number one, is a very high challenge, but it really enhances your confidence, your independence, and it really makes you being more critical in your practice. It challenges you to question what is the best available practice and what is the best way how to care and deliver person-centered care to your service users and their families as well. With PEBLS, it allows you to work collaboratively within the multidisciplinary team, which is the most important thing. Communication is a must to provide effective care in the society. However, with the disadvantage of PEBLS I just personally consider is that time to feedback with my coach and my fellow students at the end of the day.
The main benefits to PEBLS within the community, I think it was a great opportunity to be a part of. I was able to go into people's homes, I was able to lead patient care. I was basically the patients, were my patients in a way, and the coach was there to help me if they needed to intervene with anything. So I think it's definitely prepared me to actually qualify. I feel if I didn't have this, I wouldn't feel as confident, because I feel like doing the PEBLS, you feel like the nurse, you feel like part of the team, and I think that is the main thing that I'm going to take away from this, is I'm going to be ready now. I'm not quite ready, but I'll be more ready than what I ever would have been if I hadn't had this opportunity. And disadvantages, I personally haven't come across any disadvantages with PEBLS in the community. I've enjoyed every minute of it.